Hey, good morning, everyone. Thank you for making it to day 3 of the workshop. I know we've had 2 really packed days for you, so thank you for continuing to show up today. And we're really excited because we have 2 sessions, one on heat and health and one on communication of heat risks today. And so to kick us off on the heat and health topic, we have Dr. Kristie Ebi. She's joining us from Sydney, so it's 10 p.m. or 10:30, very late in the night. So we really greatly appreciate you joining us here. Dr. Chris is a professor in the Center for Health and the Global Environment at the University of Washington. She's also a very highly published researcher on the topic of heat and health and has been studying this topic for about 30 years now. She's also been part of the National Climate Assessment and the IPCC reports, and is one of the most widely well-known researchers on heat and health. So we're really lucky to have her with us today. So please go ahead, Chris.
Well, thank you very much. I really appreciate the opportunity to talk with you. I'm going to provide some pretty basic information about heat and health. Many of you in the room will know most of this, but thought it might be a good review for the presentations that will come subsequently. The presentation vaguely follows this research agenda, identifying some of the critical needs we need in the field of climate change and health. And I'll try and touch on most of these issues, except the last 2 on the economic costs and the health benefits of mitigation policies and technologies. Heat kills. It doesn't need to kill. Almost all heat-related deaths are preventable. And I thought I would illustrate the first point with this iconic graph from the heat wave in Chicago in July of 1995. You can see the heat index. And an important point from the health perspective is mortality, once a heat wave starts, increases at about 24 hours. That it's not instantaneous that people start dying from the heat. It takes a while for the core body temperature to heat up enough that, in fact, you can start seeing people die from not just heat stroke, but a broad range of other health outcomes. The figure on the left is a simplified version of how heat affects us physiologically. The key issue is our core body temperature, not the surface temperature, but our core body temperature. And as I just said, our core body temperature integrates what we experience over the course of a day. If you're an outdoor worker, as you're working hard, your core body temperature can go up. When you are exposed to high temperatures because of a heat wave, again, your core body temperature can rise. We have behavioral mechanisms and physiological mechanisms to keep that core body temperature within the fairly narrow range that is important to protect our cells and our organs. Behaviorally, when it's hot, we'll go find someplace shady, we'll find someplace near a body of water. We'll try and find some way to keep ourselves cool. Physiologically, our body has a range of mechanisms, up to and including sweating, to help keep that core body temperature down. But as we go through the day and through the evening, if it's not possible to keep our core body temperature down, then we're basically heating our cells and our organs. The heart is particularly susceptible to high internal temperatures. When analyses are done of mortality after a heat wave, about half of those deaths are from cardiovascular causes. There's also increases in causes of death from respiratory diseases, kidney disease, and a range of other health outcomes. Because of the understanding of the physiology and because it is possible to bring core body temperatures down, this is why it's possible to say that almost every heat-related death is preventable. I've listed some other consequences on the bullet points to the right. Outdoor workers are particularly affected. Worker productivity can decline significantly. sports injuries and illnesses, adverse pregnancy outcomes. Exposure to extreme heat is rising. I'm sure that's been covered in the previous 2 days. These are data from the Lancet Countdown showing adults over the age of 65, children under the age of 1, two groups that are particularly susceptible. And you can just look at the pattern and see the increase since 1980 in the exposure of vulnerable populations. When people are exposed to heat, there is a range of physiological responses. You can see heat illnesses on the left. You can see heat exhaustion in the middle and heat stroke on the right. There are different signs, different symptoms for each of these. They're well recognized, and early intervention means that people do not have to progress from heat exhaustion to heat stroke. Heat stroke is a medical emergency. Mortality rate is high. People who survive heat stroke can have lifelong consequences. And so it's critically important that when people are suffering from heat exhaustion, that there's interventions, medical interventions, to make sure that people do not go on to heat stroke. As I already indicated, there are a wide range of factors that increases somebody's susceptibility to exposure to high ambient temperatures. Some of the protective mechanisms are on the left, some of the harmful mechanisms are on the right. And I'm not going to go through these. These are here for people to understand that it's not automatic that if somebody's exposed to high ambient temperatures, that they progress to more serious manifestations like heat exhaustion or heat stroke. And that if there is that progression, it's highly variable from person to person. It depends on these protective factors, which include social capital, through a range of harmful factors like social isolation. I mentioned pregnancy outcome. There's a robust literature that exposure to extreme heat increases the risk of preterm birth. Low birth weight babies have a range of challenges that can affect them throughout their life course. So it's very important to make sure that pregnant women really understand the risks of heat and that they take protective action. As noted on the bottom from this particular study, but it's true of all the other studies, it's not just the heat. It's also factors like ethnicity, neighborhood land cover, and the concentration of extreme events. So understanding the individual exposure is important for taking effective action. Children, as I mentioned, are particularly affected. This is a study that looked at cause-specific emergency department visits by children, defined as people less than 18 years of age, in a variety of hospitals in the US. And you can see on the right, heat-related illness is at the top, but there's a wide range. You see bacterial enteritis is second. And as you go down, there's a lot of reasons that children go to hospitals during periods of high temperatures. And so it's important to think about the interventions, about the early warning systems, and how to provide warnings that go out to the families, but also to medical care to ensure that the children get the kind of care they need and understand that it is because of high temperatures when they're hospitalized. Worker productivity, another area in which there's very extensive research. This is a systematic review of 447 million workers from 30 countries, and basically confirms what you already know, that working under heat stress is a significant challenge, that it's important to help protect workers from high outdoor temperatures. At the moment in the US, there's only 4 states that have regulations to protect outdoor workers, but OSHA just proposed new regulations that would provide protection for outdoor workers across the US. When thinking about outdoor workers, it's also important to think about long-term exposures. There is a very high rate of acute kidney disease of unknown origin in Mesoamerica in Sri Lanka and parts of India. Heat certainly contributes to that. There's other factors as well. I also wanted to make a comment about survivability and livability, that these are being increasingly discussed in the literature. Jenny Van Oss led a paper that came out last year trying to provide a little more clarity on this issue. You can see survivability is pretty much related to heat stroke. It's when the core body temperature exceeds 43 degrees C within a 3 or 6 hour time window. Under those conditions, nearly everyone would die of heat stroke. Livability, though, is looking at the maximum, at the temperature at which you can have maximum safe, sustained activity without positive heat storage. In defining survivability and livability, it's critical to think about human thermal physiology. It's also important to understand that survivability limits vary by susceptibility and temperature, humidity conditions. Aging is particularly important. This is one of the figures in Jenny's paper showing the differences between outdoors, indoors, and different age groups, and shows you in the black line the survivability limit. In the colors, the yellow colors are areas that are survivable, and even those in the back of the room can tell that these curves vary by these age groups and by the outdoor conditions. A key issue in health is that heat is an equity issue. This is a figure from the 5th National Climate Assessment, going into a little bit of detail on how important it is to face the inherent inequities in terms of heat exposure. They vary by location, by social and racial factors, by economics, and then, of course, there's compound risks associated with exposure to heat and other factors. I live on the West Coast. You talk about high temperatures and you immediately start thinking about wildfires. There's been quite a bit of research on redlining. In the 1930s, federal officials redlined neighborhoods in cities, marking them as risky investments because the residents were primarily Black. And you can see from the map, the redlining refers to actually drawing that line around particular areas of the city. The consequences of redlining means that in these places, fewer trees were planted, different kinds of materials were used for building housing in those regions. And that has consequences today. As you can see that some of the hottest parts of Richmond, Virginia, are still hotter today than places that were not redlined. And this shows you the neighborhoods with the assigned lower scores in the 1930s, so less desirable redlined areas, are much hotter today. And this goes across a whole range of cities in the US. Richmond is the third from the bottom, but you can see significant differences in Portland, Denver, Minneapolis, and on down. Taking this into consideration in developing early warning systems, in developing heat action plans is important to ensure that this inequity is remedied and that people who live in those places are protected. There's been quite a robust interest in developing vulnerability mapping. This is one example for the state of Washington, developed by the Center for Health and the Global Environment. It's the Climate Heat and Health Risk Tool that overlays vulnerabilities with susceptibility and with ambient temperature to highlight places that are at greater risk. This is being used not just by city officials, state officials, but also is being used by a variety of NGOs and, interestingly, by a variety of utilities to better understand what the demand will be for electricity when temperatures are pretty high and how the populations in these places can be better protected. Can't talk about heat from the Pacific Northwest without talking about the heat dome for a moment. As you all know, it was an extraordinary event that the heat wave broke previous temperature records by 10 degrees that had not been heard of before. It was a time of the year when it should not have been anywhere close to the temperatures that we experienced. You can see from the map how high the temperatures were. The data, it takes a while to collect health data, particularly death certificate data. And overall, during the heat dome, there were about 440 excess deaths from the temperatures. There was a rapid detection and attribution study that said this event was virtually impossible without climate change. So these are 440 people who died from climate change. I'm focusing on health, but it's not just health. When you look between Seattle and Vancouver in the Salish Sea, the temperatures were so high during low tide that about 1 million mussels, clams, and oysters were cooked. This is, of course, food security for the sovereign nations, affected the wheat crop, affected the cherry crop as well. More and more heat is being viewed as an all of society problem for these reasons. I'm happy to talk more if there's questions about the heat dome. It was quite extraordinary experience for the region that was completely unprepared. Any day now, the region is going to be, at least in Seattle, going to be introducing a heat wave early warning and response system, which is going to be great. Detection and attribution, there was a modeling study of over 700 locations, 37 countries, and the end result is about 37% of heat-related mortality over the last couple of decades is because of climate change. You can see the proportion varies across the countries. You can see Africa is represented by just one country, which is clearly insufficient. You can also see quite a bit of variability, indicating that there are lessons that can be learned that can be applied in other regions. It's a great place to start, and more work needs to be done on these kinds of detection and attribution studies. In looking into the future, I like using this set of figures from Drew Schindel, looking at heat-related mortality projections at the end of the century. I think this is quite useful because it shows projections with and without adaptation at high and low emissions. All you need to do is compare the map of the US in the upper left and in the bottom right to quickly recognize these are completely different worlds, and highlights the critical importance of both adaptation and mitigation. Another point in the bottom right, even with adaptation and with low emissions, projections indicate that heat-related mortality will continue to rise, in large part because populations are aging. This means that health systems need to be prepared for a greater number of deaths than what have been experienced over the last few decades. There's quite a few studies showing that people are adapting to these higher temperatures, not through official mechanisms, but probably by purchasing air conditioning. This shows you the change in the number of deaths in different regions in the US by the increase in the prevalence of air conditioning. Overall, air conditioning does help save lives, but we can help save lives without air conditioning everywhere. So there's possibilities to achieve the same kind of result without increasing greenhouse gas emissions for areas that rely on fossil fuel plants to run their air conditioners. Another point I wanted to make, this is a study back from 2017 for which there's been very little follow-up. There's a lot of studies projecting what could happen as climate continues to change, and focuses on projecting the numbers of people at risk, the number of deaths that could occur. This study instead asked a different question. It asked, assuming that current mortality from heat waves is acceptable, which it's not, the deaths are preventable, but if we say it's acceptable, then how much risk reduction is required to maintain heat-related mortality at the current level? This focuses, as you can see, on different areas of Europe under RCP 4.5 and 8.5. And the bottom line is to maintain current levels of mortality from heat for particularly vulnerable populations over the age of 65. If we're under high emissions, then at least a 75% reduction in risk. That's obviously a very large number. It's not clear how to reduce the vulnerability of populations by that much. It's an urgent call for finding ways to do so. As I've mentioned several times, it's not just heat. Heat interacts with other factors. This particular paper looked at population growth and trends in higher temperatures. This map shows you the contribution of either the warming we're experiencing with climate change or population growth and aging. And the dynamics are different from different places. You can see in India, most of the projected increase in mortality has to do with increased warming. But in many parts of the world, it more has to do with population growth. Unfortunately, many projections of the health risks of climate change, particularly the heat risks, are not adequately taking population growth and aging into account. That will change the kinds of results that we're seeing and increase the urgency from the paper I just showed you from Ostrom of making sure that we think about protecting those populations even as temperatures continue to rise. The key adaptation strategy is developing some kind of heat wave plan. The plan for England's been around for quite a few years. You can see the core elements for that plan. And you can see that they have 4 heat wave alert levels based on what's locally relevant. That plan has been effectively reducing mortality. It is not yet perfect. In the heat wave last summer, there were, I think, close to 1,000 excess deaths because the temperatures were so high and so far beyond what the heat wave plan had factored into, that there is changes taking place right now to make sure that the plan will be more effective as we see these much higher temperatures. I know that you can't see this. It's here to illustrate the detail in which the plan goes. These are the different alert levels. This is one of many tables, shows you what health and social care settings and local authorities need to consider, need to make sure happens when there are these different levels of warning. This is another figure from that heat wave plan just to illustrate all the different actors that are involved. So you, of course, have health and the Met services, but social services, schools, residential homes, et cetera. And it was a really good example of a comprehensive and, as I said, effective plan. As I mentioned before, there's lots of ways to stay cool without having to use air conditioning. The figure on the left is from a paper in the Lancet, led by Ali J, a physiologist, and just shows you a broad range of ways that people can keep cool, even in low resource settings. On the right are sustainable cooling strategies to protect health, and these are organized by different settings, such as aged care homes, workplaces, schools, et cetera, pointing out different levels of what could be done as our infrastructure. I don't know about where you live, but where I live, we've just got nothing but cranes downtown. As our infrastructure continues to be modified, we need to think about the changes that need to be made at the building and the urban level to ensure that we have cooler environments as temperatures rise. One of the key issues I mentioned before is tree cover. This is a relatively recent study in Europe that asked the question of, there is an EU goal that every city have at least 30% tree coverage. And the study looked at, if that were to happen, how much would heat-related mortality decline? And the answer is actually quite a bit. that there would be a significant reduction in mortality just ensuring that there's adequate tree coverage. Of course, you're all working on various aspects of climate change and understand it's not just any tree, but making sure the trees that are planted are going to be resilient to higher temperatures and in many places, less water. As I mentioned, heat isn't all a society problem. This is a figure used by the Global Heat Health Information Network, really emphasizing the need for multidisciplinary, multi-sector action and making sure that there are all of the appropriate agencies, NGOs, and others involved in the planning so that we can, in the end, provide safer environments, even as temperatures continue to rise. And with that, I'm not going to do the last slide, and I've left about 2 minutes for questions, but we started a little bit late. So if there's time, I'd be happy to answer a couple of questions.
Yeah, we do have time for a couple questions, so.
Hi, Chris. This is Jane Baldwin. Hi. So I've been very influenced by something I hear you say frequently, which is heat-related illness is preventable. I found that very motivational in my own work. But when I'm talking to, say, reporters or other young researchers, I often get stuck in how to deal with the caveat of, but we're living in a rapidly changing climate and seeing unprecedented heat extremes. So I'm curious how you'd caveat that statement, given that we're all already seeing climate change. Do you think we can still confidently say all like heat-related illness is preventable, or how do you deal with that caveat now?
It depends a lot in terms of the time frame you're thinking about, the temperature projection at the end of the century. I mean, but people don't need to die in heat waves. We're seeing temperatures on the West Coast that are pretty typical in other parts of the world that don't lead to mortality. We know that if we adjust our infrastructure, if we have effective heat wave early warning and response systems, if people understand that heat is a killer and that we have to respect those higher temperatures and take action, yes, we can prevent people from dying in the heat. It's a pretty big agenda of what needs to be changed, but it's not impossible. Cool. I mentioned Seattle's a sea of cranes, right? If we really focus on modifying our infrastructure as we're building new buildings, if we start planning of regulations, are you going to say that every building needs to have a white roof, which we know decreases temperatures indoors? Every building over a certain size needs a green roof, which is even more effective in reducing temperatures for the larger buildings. Those are regulations that could be put in place and make sure that we're focusing on how we're going to be living in higher temperatures. So I'm a cautious optimist in this area that we do have a lot of knowledge of what would be effective in terms of protecting people in higher temperatures. Does that help?
Yes, thanks very much.
I just have a quick question. I see if the body core temperature reaches 43 degrees, then it's really dangerous for like everybody. I'm wondering if we can do something, say, hey, for this city, if the temperature and humidity, which like the product of weather forecast, reach certain level, it will lead to a core body temperature over 43 degrees, that we can actually give like everybody a warning, hey, saying this is very dangerous, and we can like push the laws and regulations to stop like people working from outside. I'm wondering if there's any like methods or things people doing research on these things to prevent the very dangerous heat waves to kill people.
As I tried to explain, and I clearly didn't do it very well, there's lots of variability in how people respond to higher temperatures. And so this is not like in meteorology where you can just set a threshold. We know that the threshold for survivability is an internal temperature of 43 degrees C. It takes quite a lot before your body gets there. And it depends on your age, your physiology, your fitness, the clothing you're wearing, the work that you're doing. And that's why it's important in early warning and response systems to focus on groups that are most vulnerable. And an area, surprisingly, for which there's been almost very little research is how to motivate people to make change when they're provided with warning. There's a very old study from Scott Sheridan that hasn't been repeated. One summer, there were students. He had students in 4 cities that had heat waves. And I forgot how they did this, but within a week of the heat wave, the students conducted non-random samples of adults over the age of 65. The results were greater than 90% knew there'd been a heat wave. Most people know when it's hot. Surprisingly, 75% could name at least one thing that people at higher risk, i.e. people like themselves, should do differently. And only 50% did anything. People don't think that they themselves are at risk. And so they hear these warnings, but don't take action because it's not me. I'm healthy. There's all kinds of reasons we say this applies to someone else, but not to me. And that's an area where a lot more understanding is needed so that the warnings that go out will be more effective. Secondly, it's focusing on places where people are at higher risk, like elderly care institutions. In most of those, they're going to need to have air conditioning, making sure there's a cool room that people can go to cool down their core body temperature. And these are operational questions, which is why several cities in the US now have heat officers. And that's going to become increasingly common to address these operational issues at the city level, at the same time making sure there's coordination across a region, because you don't want to have warnings in one city and have different warnings in another city. But that's a whole nother topic. Anyway, I hope that was helpful.
Thank you. We have time for one quick question. One more quick question.
Hi, Kristie. This is Chaoren from the Hong Kong U. Originally, I saw we can meet in person. Anyway, thank you for your sharing. You show us this kind of global picture or even regional picture about heat wave related studies. I'm just wondering, since you're a top expert in this field, so what is the barriers or what is the difficulties? I mean, still at the city level or even community level, we can do some improvement to deal with this kind of heat issues. Thank you.
I think the basic issue is awareness. Very few people really understand that heat's a killer and that actions need to be taken to protect ourselves, our family, our friends, our colleagues. And raising that awareness is critically important so that we do start educating the public about the risks. And when you do so, of course, what you have to do to take care of yourself. That seems to be the biggest barrier. What happens is, unfortunately, you have a heat wave, you have excess mortality, and then we have heat wave early warning systems being implemented. We need to think about how to make that happen proactively and ensure that places are much better aware of the risks. And I have to say that the media is really working on this issue. There's been several newspapers in the US where the newspapers analyze local data to show that the official numbers of deaths and heat waves are a very significant underestimate. CDC just upgraded its numbers and estimated about 1,200 Americans die every year from the heat. But studies that have done excess deaths analyses, studies that have done modeling, taking into account some of the susceptibilities to the heat, have come up with estimates more around 10,000 Americans die from the heat. Last year, there was an analysis around Europe for the year, I think it was 2022, but it could have been 2021. And across Europe, estimated about 60,000 Europeans died from the heat. having those kinds of numbers, having that kind of understanding can really incentivize making the changes that are needed.
Thank you, Chris. Thanks for, we actually have a couple of questions online. If you're able to look at them and maybe respond to them, we have to start the next session, but the questions are around like how we manage unprecedented risks and how we adapt to heat in the context of compounding hazards like hurricanes and heat that we've heard about here at the conference. So yeah, if you could respond to Michelle online, that would be great.
Okay,
yeah.
I'll try to do that.
Yeah, thank you so much for joining us so late in the evening for you. And yeah, well, let's just thank Dr. Chris again.
Thanks everybody for listening.